Thank you. Okay. I just want to say thank you, Dr. Bruner. Thank you very much. Very illuminating.
So I just want to put this in context and share with you a proposed intervention. I just want to start with a little bit of the statistics because it's a health disparity issue. You know, health disparities mean health issues that are concentrated in poor communities and communities of color. That's what health disparities are. So these 5 to 7 years or 2 to 7 years of life lost are not equally distributed amongst the population. They're concentrated in poorer communities. They're concentrated in communities of color. So what we have in Richmond, if we look at our 5th and 7th graders, is what, 34% of the African American students and 33% of the Latin American students are obese. If we do nothing, if we have no intervention, when this cohort grows to adulthood, 42% of Richmond's adults will be obese, almost half of our population. There will be no possibility to make Richmond a healthy community because those 42% of people will be fighting off chronic illness. They will not be able to have lots to put out into the community because we will actually be needing to take care of them. So this is what, you know, what we face. We all are absolutely devastated when we hear about a homicide, and that catches our attention. But most people in Richmond are going to die of heart attacks and strokes and cancer. That's what most of us are going to die of. And we will be sentencing these kids to lives full of early illness and early death if we don't do something. So what do we do? Our suggestion is that we put a sugary sweetened beverage tax on the ballot in the November 2012 ballot and have the residents of Richmond decide whether or not they want to do that for 2 reasons. First reason being to discourage the use. The second being it gives us a chance to take the revenue, if we so choose, and use the revenue to prevent childhood obesity, to promote healthy eating and active living in Richmond. And there's any number of projects that are obvious. I think we heard tonight that we're down somewhere between 12 and 20 soccer fields and that there aren't places for our children to play. I think we're down 2 softball fields. We are used to the half-steppers coming here and having to ask for money, or the Eagles or the Steelers, or all of these groups that we can expand. We have a burgeoning urban ag community that's very interested in gardens in our schools. So there are a number of interventions we can try, if we so choose, if we go ahead and do this. The plan at this point is to ask the city attorney and the city staff, because there's a lot of logistics involved here. We're not thinking to make this for restaurants, for example. We're thinking of how do we make this simple and something that a merchant can comply with, and a way that we can track, and a way that we can understand the revenue coming in and so forth. So there's a lot of work to do to make this a reality logistically. But those are the basic outlines, and that's kind of what I'm going to be asking for you to support tonight. Now, why is it that this, because when I went to school, 5–10% of people were obese. Why is it that a third of our Latin American students and a third of our African American students are obese? There are 2 things that lead to it. One is behavioral choices that don't lead to healthy eating and active living. And we know we learned so much recently about the built environment, about not having places for people, for children to safely exercise, about about food deserts, about not having the right healthy, nutritious foods in our communities. So one part of it is purely behavioral, and that's going to take us to change our behavior, change our children's behavior, put healthier food offerings in these stores, change what we do in the schools, et cetera, et cetera. But there's another reason that's a little more invisible, and that's that poor people have higher stress hormones because they live in a more stressful environment. So, for example, there's an illness, metabolic syndrome. It's a precursor to diabetes, it's a precursor to hypertension, it's associated with obesity, and it happens more in poor communities. In fact, it's like a stepping ladder. You can see the more disadvantaged you are, the more likely you are to get this illness. So what is the antidote for stress? Right? If you get poisoned, you want to go to the emergency room. The antidote is what reverses the poison. The antidote to stress is building community. In Dr. King's terms, building beloved community. So I know that this is an issue where people will come down on both sides, just like gambling was an issue for Point Malate, where people came down on both sides. But I want to underline that it's this community building that's key to reducing stress, and how we talk about this when we're divided about an issue and how we approach this will be key in terms of what kind of community we are and the kind of community we build. So this is a challenge and this is an opportunity, and we will be the first city in the country, if we do this, to establish a sugary beverage tax that is specifically as a public health measure to prevent childhood obesity. So I look forward to the public speakers. I know that there's strong feelings on both sides. I look forward to a lively and a respectful discussion, and I hope that we agree to put this on the ballot to give the Richmond voters a chance to decide on this in November of 2012. You should know that San Pablo plans to follow suit in 2014, and I hope it will be an issue for the entire Green Corridor going forward.
Okay, thank you.